Dr. Stephen Hahn, he's the commissioner of the Food and Drug Administration, the FDA, and a member of the government's coronavirus task force. Commissioner, good morning, sir.
Good morning, Savannah. Thank you for having me on the show today.
You're welcome. You know, I know the FDA has some developments to share this morning. I do want to do the big picture first. We have 152,000 deaths in this country. The average daily rate of deaths is now over 1,000. Hasn't been that since early June. And then you have that Association of Medical Colleges releasing a report saying if the nation does not change its course and soon, deaths in the U.S. could be well into the multiple hundreds of thousands. Do you agree with that assessment?
Well, this is a serious situation, and my assessment is that we have to take this serious. This virus is still with us. We've seen some evidence that the very common sense public health measures that we can take, wearing a mask, following local guidance with respect to wearing a mask, social distancing, hand hygiene, protecting the vulnerable. We've seen early evidence that that works. We must take this seriously, and we must do that because we absolutely need to reduce the number of cases in the country, because that is what's leading to the deaths that we're seeing.
You know, I was going to ask you this later, but I mean, since you brought it up, and I've heard interviews from you, you've been preaching that gospel, saying, please wear a mask for many, many weeks now. You know that Congressman Louis Gohmert, who is a mask critic, has contracted COVID-19, and now he's suggested that maybe it's the mask that actually caused it. He said, I can't help but think if I'd been wearing a mask so much in the last 10 days, I wonder if I would have gotten it. Moving the mask around, getting it sitting just right, I am bound to have put some virus on the mask that I sucked in. Do you think that is a likely scenario? Do masks cause COVID-19?
Well, we don't have any medical evidence that that's the case. When I heard the clip with Representative Gohmert, and I've heard from family and friends, there's lots of people who have questions about the masks. What our data show is that people should wear masks, particularly when they can't socially distance, and they should follow their local ordinances with respect to masks. That's something that you're right, we've been talking about for weeks and months, and I think should be continue the message that the American people hear.
Is it frustrating when you have a sitting congressman who has COVID-19 say something like that?
Well, I think getting the message out is the most important thing here, Savannah. We just need to be consistent in what we're saying, these common sense measures to the American people. And I will continue to do that to make sure that people understand that we have the power. We have the power as the American people to slow the spread of this virus. We've seen this virus spread in the U.S., but we've also seen it around the world. So we know it's with us. We have to take this seriously.
Let's talk about vaccines. There are reports, and actually an FDA official said that there could be a vaccine approved for emergency use in a matter of weeks. Is that correct? How soon?
Well, Savannah, I've said before, I was a cancer doctor before I became FDA commissioner, and I didn't have a crystal ball then, and I don't have a crystal ball now. We do have a number, now 2, phase 3 trials that have started. And this is, of course, in record time from identification of the virus to a phase 3 trial. Now, that phase 3 trial is going to provide us the data to actually determine whether a vaccine is safe and effective. We've seen a huge number of Americans who've signed up as potential volunteers for these trials, and that's great news. And that will help us accelerate the development, will help the developers. But FDA's role in this is to provide assistance to those developers, but we're going to call the balls and strikes on this. And one thing I want to tell you and your viewers, Savannah, is that we will not cut corners. We will use our very high standards of safety and effectiveness. We'll look at those data and we'll make a determination based upon those high standards. We have terrific scientists and people at FDA, and I know and I'm confident that we'll do that job on behalf of the American people.
I know you don't have a crystal ball, but real quick before I leave it, the president said last night there will be a vaccine before the end of the year. He said maybe sooner. I know anything is possible, but would you consider it to be a strong likelihood that we could have a vaccine ready to be distributed by the end of the year?
I mean, all I can say at this point is it's possible. Things have been moving very quickly. I know our team is looking at data in real time from these trials, and that should help us expedite this. But the most important message, I think, Savannah, is we're not going to cut corners on this. We're going to look at those data and make the right decision for the American people.
Before I let you go, I have to ask you about hydroxychloroquine. It's in the news once again. The president retweeted a video promoting it. He even said, I took it for a 14-day period, and I'm here. I don't think you lose anything by doing it. The vice president said yesterday many Americans have had positive experiences with hydrochloroquine. But the FDA actually revoked emergency authorization for the drug because it wasn't effective and it wasn't safe. It was potentially dangerous. So once and for all, should people be taking hydroxychloroquine?
So just to be clear, we revoked an EUA, an emergency use authorization, at the request of another government agency, BARDA. And this was for drug that was authorized for use in sick hospitalized patients. We had data that when this drug was combined with others, there were some risks associated with that. But the question you're asking me is a decision between a doctor and a patient. A doctor and a patient needs to assess the data that's out there. FDA does not regulate the practice of medicine, and that, in the privacy of a doctor-patient relationship, is where that decision should be made.
Are you concerned at all about misinformation about this drug in particular?
What I'm concerned about is that FDA provide all the information about the side effects, the potential side effects, as well as the efficacy. As you know, these drugs have been approved for a number of years for other indications by the FDA. We know that they're safe in those settings, but we want to make sure that the right information is out to providers so that they can make this decision with patients.
Well, Dr. Hahn, yes, you have your hands full, and we appreciate your work. Thank you so much. Thanks for your time this morning, too.
Thank you, Savannah. Have a great day.